If I were a coach, I would say, well, the last few years have been real winning years in which we basically had positive phase 3 trials for several years in a row, and basically demonstrating that for essentially all diffuse infiltrating gliomas, adjuvant chemotherapy is useful. As a coach for this year, I will say it's a rebuilding year. To put it in perspective, at ASCO, there were no phase 3 trials on the oral session. There were 2 phase 2 trials, and the rest were phase 1 trials. So sit back here. What we're going to do is really take a glimpse of some of the developing opportunities in the field of neuro-oncology. We're going to start out with glioblastoma, and then we will talk about lower grade gliomas on what are some of the ideas that are coming forward to move us into the next generation of treatment for primary brain tumors. The first study was a randomized phase 2 trial in patients with recurrent glioblastoma. As you know, standard therapy for glioblastoma consists of radiation therapy with concurrent and adjuvant temozolomide, with or without tumor-treating fields. For recurrent glioblastoma, there is one FDA-approved indication, and that's for bevacizumab. In the setting of recurrent glioblastoma, bevacizumab prolongs progression-free survival, but not overall survival. In this particular trial, the standard of care was considered to be bevacizumab, and the experimental arm was bevacizumab plus pembrolizumab. And you can see the schema here, where bev is given every 2 weeks, pembrolizumab given every 3 weeks, so they happen to come together every 6 weeks. Here are the results. As you can see, in progression-free survival, there was a suggestion of improved outcomes with the combination of, let me back up. Trial design, pembrolizumab alone versus pembrolizumab with bevacizumab. The median progression-free survival was longer in the combination arm. Progression-free survival at 6 months was longer. And the median overall survival, however, was not different between the two groups. And here are the progression-free survival and overall survival distributions. As we have seen in many, many studies that incorporate